And now we're going to, finally for this session, we're going to welcome Carolyn Nikoloski, who's the CEO of Mental Health Australia. Carolyn is a mental health policy specialist who is committed to improving mental health and reducing social disadvantage. She has extensive experience working across government and non-government organisations, including the Department of Veterans Affairs, the Australian General Practice Network, Beyond Blue and Good Shepherd Microfinance. Carolyn led Beyond Blue's policy reform agenda, which influenced the establishment of low-intensity mental health services across the country and the routine provision of follow-up care for people who have attempted suicide. Welcome to you, Carolyn, and let's hear from a different perspective again. Thank you so much.
Thank you so much, Jackie. Now, I was reflecting on the AI presentation we had earlier, and my phone has been telling me that it is time to stand up. So I think I've got the slot just before afternoon tea. So I might ask everyone just to stand up for like 30 seconds, have a quick stretch because we've still got half an hour to go till you get some sugar. So perhaps have a quick chat with the person next to you about what your key takeout has been just from the last few sessions. All right, we might come back together. I hope that has just given you a little energy boost to get through this next half an hour. So as Jackie mentioned, I'm Carolyn Nikoloski. I'm the CEO of Mental Health Australia. I would like to thank Auntie Lola for her very generous and kind welcome to country this morning. I too would like to acknowledge that we're meeting on the lands of the Indigenous people, and I acknowledge elders past and present. I'd also like to thank Amanda for her acknowledgement of people with lived experience and their critical role in driving change in our mental health and suicide prevention systems, along with, of course, the important role of family carers and supporters in driving that change and advocacy efforts. And I think we just heard earlier from Michelle about the importance of lived experience-led research in also driving that system reform and creating better mental health policy. So that's really what I'm going to focus on today, speaking about the importance of translating research into better mental health policy and reflect on some of the lessons learnt that we've had from our role at Mental Health Australia. So for those of you that don't know, Mental Health Australia is the national independent peak body for the mental health sector. And our role is all about uniting the voices within the mental health sector to provide pragmatic policy advice to government that will improve mental health. So we have over 140 member organisations that include service providers, professional associations, organisations representing people with lived experience of mental ill health and their family carers and supporters, state and territory peak bodies, and importantly, organisations that undertake research. So many of our members are sitting in the room today, including the ALIVE National Centre for Mental Health Research Translation, the Black Dog Institute, mental health units across many universities, including ANU, the University of Canberra, the University of Sydney, and the Queensland University, along with, of course, our hosts for today, the Mind Gardens Neuroscience Network and Psychosis Australia. So it's no surprise, given the makeup of our members, that we firmly believe that research has a really critical role to good policy development and successful advocacy efforts. So throughout the presentation this afternoon, I'm going to talk to some of the current opportunities that we have ahead of us to influence psychosocial reform nationally, drawing on research insights. Along with the integral role and place that mental health research has in creating better mental health policy, I'm going to provide 3 ideas for priorities that I think that the sector can progress to improve the translation of research into policy and practice, and also some examples of how Mental Health Australia has achieved that in our work. So firstly, I wanted to touch on, I think this is a really important time for research to be informing mental health policy. And Sophie talked to some of this context at the start of the day. So there are multiple reforms playing out right now in the area of psychosocial support, and there's a key opportunity for us collectively to try and influence those reforms. So health and mental health ministers have now agreed to meet twice a year to discuss mental health priorities and to progress interjurisdictional reform. So at the first meeting back in August, a couple of months ago, they agreed to release the analysis of unmet need in psychosocial support outside the NDIS. And that research identified that there were at least 490,000 people in our community who need psychosocial support and currently aren't able to access those supports. So ministers have agreed to discuss this at their next meeting that will happen in February. And this is a really critical time for us as a sector to put up our ideas on what we think the solution looks like and make it easy for government to act. And we've got a key role in being that conduit between what the community needs, what our experience is of on-the-ground implementation, and then how that can feed up into government policy and political decision-making processes and making it really easy. So we've got that process underway. We also know simultaneously government is considering the design of foundational supports for people outside the NDIS. And there are also significant reforms underway within the NDIS itself, particularly including the implementation of new NDIS legislation and the response to the NDIS review. So it's a busy space and there's a lot of opportunity for us to influence what this next stage of reform looks like. And certainly at Mental Health Australia, our goal is really to provide government with practical policy solutions that's underpinned by sound research, combined with the expertise and experience of people with lived experience and their family carers and supporters, together with those delivering services. And it's by weaving together all of those insights, together with the understanding of the policy and political decision-making process, that we think we can achieve the greatest impact. So we know that good quality mental health research is really integral to good mental health policy. So in 2020, the Productivity Commission inquiry into mental health put it as, research is an essential component of a well-functioning mental health system because it generates reliable information on which to base decisions and policies. And the National Mental Health Research Strategy affirms research is essential for achieving the vision of a mentally healthy Australia. We know this, yet we still have a long-standing problem that the proportion of funding allocated to mental health research does not match the proportion of the burden of disease. So, for example, in the 5 years leading up to 2018, funding for research in cancer was between 2.2 and 2.5 times larger than funding for mental health. In contrast, the share of the total burden of disease for cancer is only 1.5 times larger than that of mental ill health. There's also a significant gap between the knowledge generated through research and its application through policies, funding, and on-the-ground service delivery. Although the exact figure has been debated, it's reported that it takes on average 17 years for research to be translated into practice. That is clearly far too long. Of course, we do have some good work underway at a national level. There's significant investment through the Million Minds Mental Health Research Mission to research that's focused on addressing key national mental health research priorities, as well as the National Health and Medical Research Council and private, philanthropic and university-led research. But clearly, we need both greater investment in mental health research, along with greater alignment between research and key policy deliberations, and making that gap between research being generated and then it being applied on the ground. So we know that research is not always influencing policy and service delivery. Again, in 2020, the Productivity Commission found that at a systemic level, mental health and suicide prevention research in Australia has largely been misaligned with both national strategic priorities and current real-world problems, and has generated evidence that is not translated in practice or widely disseminated. As a result, mental health and suicide prevention research appears to be disconnected from policy making, program development, service models and delivery, and desired consumer outcomes. While governments have recognised these shortcomings and are supporting some initiatives to address them, more can be done to ensure that research is coordinated and making efficient use of research funds. So this really highlights that there are some missing pieces of the puzzle about good quality research being conducted and then that resulting in better outcomes and experiences on the ground. We don't yet have a robust process in place to prioritise which research is funded and which research outcomes are then pursued through our advocacy efforts to inform subsequent policy and funding decisions. And Michelle spoke to this a little just a moment ago. The Productivity Commission also told us that research gaps arise because there are few national mechanisms for that prioritisation process and overseeing mental health research to ensure that it's aligned with the mental health policy making process and challenges experienced. It also told us that research gaps often arise because people with lived experience of mental ill health and their family, carers and supporters are not systematically involved in prioritising research. And it showed us that there's a missing piece of work in translating research into actionable policy asks for decision makers. So what great opportunities we have ahead of us. So of course there are things that we think government could do better to make better use of mental health research and how it's funded it. But equally, I think there are things that the sector can do in and of ourselves. So I'd like to propose 3 priority actions that we can work on together to hopefully result in better, tangible outcomes for people. Firstly, let's work to improve the effective translation of research into policy and practice. That's complex work and hard to do, but it's possible. Second, let's revisit how we set priorities for research and the important place of people with lived experience in setting these priorities. And third, let's better connect the work of researchers, advocacy organisations, policy decision makers and service providers so that we're all learning from one another and creating better ideas and solutions than what we would do if we were working alone. So to illustrate how these ideas can come to life, I'm going to talk you through an example of how Mental Health Australia has tried to bridge the gap between research and its informing our advocacy efforts and policy recommendations to government. So I'd like to start with an example of how effective partnership-based approaches can be between research and advocacy. So in 2023, we saw the convergence of the NDIS review that was underway and the unmet needs analysis that I referred to earlier. We knew those 2 pieces of work were happening concurrently, and we knew that there would be an opportunity to influence key points in the political and government decision-making processes as a result of those significant research and reform opportunities. We anticipated that policymakers would need both pressure from external advocates such as ours to deliver change, along with advice on what psychosocial supports to fund. So to make the most of that opportunity, we needed to have the right information on hand to effectively prosecute the case for investment in psychosocial services. So we set out to develop practical advice to government on evidence-informed and good practice psychosocial services so that when the time came, we could demonstrate to government what the next step in reform could be and make it easy for them to act. So Mental Health Australia worked in partnership with the National Mental Health Consumer and Carer Forum, some of whom those members are in the room today. So we worked in partnership on developing up this advice for government. And together, we firstly consulted the research along with the researchers themselves. From that research review, we developed a list of psychosocial services which had been shown to achieve good outcomes. But just as importantly as consulting the research is testing its assumptions with people with lived experience of mental ill health and their family carers and supporters, and those people providing services. That's why we then tested that list of psychosocial services through online consultations with over 100 experts, including people with lived experience and their family carers and supporters, service providers, researchers, and other key stakeholders. We also conducted 2 surveys answered by over 200 people with lived experience of mental ill health and their family carers and supporters, asking them about what parts of psychosocial services were most and least helpful to them. It was really important for us to sense check what we were hearing from the research with people with lived experience accessing services, along with those delivering services. So through that scoping and testing, we identified a diverse array of effective psychosocial services which have been shown to reduce hospital admissions and length of stay, improve mental health and wellbeing, improve personal recovery, improve housing outcomes, improve physical health, improve social inclusion, improve education and employment outcomes, and improve outcomes for family carers and supporters. And what the research told us was confirmed by people in the community. We know that psychosocial services work. So in addition to that piece of work, we also drew on work previously undertaken by Community Mental Health Australia, where we developed and tested principles that should underpin the delivery of all psychosocial supports. So all of that work culminated in the Mental Health Australia and National Mental Health Consumer and Carer Forum advice to government on evidence-informed and good practice psychosocial services. We're now proactively undertaking advocacy in relation to that advice. So we've written to relevant members of the Australian Parliament and senior government officials, we've met with ministers, we've been in regular contact with the Department of Health and Aged Care to talk through the advice and ensure that it's informing their deliberations about how the government responds to the unmet needs analysis. We're in discussions with the Department of Social Services to ensure that they're drawing on the advice in the design of foundational supports. And we're talking with the National Disability Insurance Agency to ensure that it's also underpinning and informing reform within the NDIS itself. So we'll continue to advocate for the adoption of that advice through many government consultation processes so that we can ensure that it's driving policy decision making. And I think that's a really practical example of how research can be used and translated in something tangible and actionable that government can then act on. So there's another important piece of the puzzle when it comes to research-informed advocacy approaches to influence sound policy development, and that's prioritisation, which we've heard from Michelle about just a moment ago. So in short, how do we choose which policy issues arising from the research to pursue with strong advocacy? We need to have a really robust process to underpin that prioritisation. So one example of how Mental Health Australia has gone about doing that is through our work to develop a policy position on housing and mental health. So, as is often the case, it started with research. I'm sure many of you would have heard of the Trajectories report on housing and mental health pathways. This was an important national study conducted in collaboration between Mind Australia and the Australian Housing and Urban Research Institute. This research developed a clearer understanding of the relationships between housing and mental health pathways for people with lived experience of mental ill health to identify the potential points of practical intervention and key issues for system improvement. So this was a really important piece of research, the findings of which had real opportunity to influence national reform and policy decisions. But the difficult part was how to identify which policy issues to prioritise, and that is what we focused on in our advocacy efforts. So Mental Health Australia worked with both Mind and the Australian Housing and Urban Research Institute to undertake some further research through a Delphi process whereby a panel of experts is surveyed to arrive at a shared opinion. And of course, any sound Delphi process should of course involve people with lived experience along with those with learned experience. So at the end of that process, we arrived at a set of core priorities which have formed the focus of our position statement and targeted advocacy on housing and mental health. So I think what I'm trying to highlight here is not just what the research tells us that is important, but equally important is how do we take that and prioritise the key asks that we want to advocate with government. And the way that we prioritise which research issues to drive through advocacy, of course, must include and be informed by and led by the voices and expertise of people with lived experience and their family carers and supporters. So I'd like to acknowledge the important work of the Alive Centre for Mental Health Research Translation in really leading the way in setting out what these research priorities are. And it's important that the rest of the sector is guided by those research priorities. So, what does all of this mean? How can research be used to create better mental health policy? A moment ago, I spoke to three key takeaway actions for all of us. So firstly, let's work to improve the effective translation of research into policy and practice. So in 2020, the Productivity Commission highlighted that a challenge when it said mental health research is generating little evidence that is translated into practice or disseminated widely. It noted that research may not be relevant to the needs of policymakers or presented in a user-friendly format. There is a clear need for translational work, like the advice to governments on psychosocial services that I've described. This translational work takes the deeply valuable, complex work of researchers and translates it into information that's easily consumable and immediately actionable by politicians, senior government officials, and other key decision makers. Mental health researchers do amazing work, but that translational piece is so important to ensure that it results in improvements on the ground. And ensuring that we're communicating the right information at the right time to influence political and policy processes is critical. The second key takeaway action for us all is to revisit how we set research priorities, cognizant of the important role of being led by people with lived experience in setting those priorities. So again, the Productivity Commission told us that historically there have not been mechanisms to involve people with lived experience of mental ill health in systematically prioritising the mental health research focus. There is clearly a need for more robust methods for prioritising which research will be undertaken, and it's great to see that we are getting some progress in that space that we can now build on. So finally, the third priority action for the sector is that we must work in our day-to-day work on the better connections that we need to bring together the views and expertise across researchers, advocacy organisations, policy decision makers and service providers. I think all of the examples that I've spoken to today have all involved such collaborations. So change happens through connections, and it's by coming together and bringing together the diverse expertise and views that we have in the room today, but also those not in the room and the voices that we don't hear. It's bringing those insights together that will be able to create better change than what any of us could do alone. And really, it's where the magic happens. And that's where we need to focus our efforts in really listening and understanding from one another and thinking about how we can better connect all of our work to ultimately result in better outcomes and experiences for all people in Australia. So thank you so much for your time. If you have any questions in detail about the presentation, please feel free to get in touch with our fabulous policy and advocacy team at Mental Health Australia, and we've just got the email up on the screen. So thank you.